I must admit that with regard to Prime Minister Johnson, normal protocols would go out of the window. But you would need to be reasonably concerned, especially at this time of intense activity in intensive care, to say, I want this patient in the ICU so that I can monitor them more closely and give them a dedicated team to look after them.
So do you think doctors here are acting in an abundance of caution because of the role the Prime Minister has, and they do just want to make sure that they can keep an eye on his observations?
We will never know, but we need to bear that in mind as well. So when I was the clinician and I did quite a lot of respiratory medicine, when I got high-profile patients, it always threw our protocols out of the window, and it created a lot of extra activity because it happened to be, for example, in this case, our Prime Minister Johnson.
Now, looking at the treatments that the Prime Minister is receiving, from the briefing that was given earlier on, Downing Street officials are saying that the Prime Minister is being given the normal oxygen supply route, but we do know that there is different procedures available, including a CPAP machine and ventilation. Can you just talk us through the different stages of the treatment that could come if the Prime Minister's situation was to deteriorate?
My first advice to the clinicians, and who am I to advise, but I'll give it in any case, is hold firm, hold fast, and do what you normally do with all your patients. This is very important because when somebody like a Prime Minister gets admitted to ICU, you will get a flurry of advice coming in from all quarters, everyone asking you to try different routes and different protocols. This is the time to remain steady and do what you normally do, what you know what to do. So initially, I would do nothing. I would want to watch the patient and see how they are. Second stage, I would want to look at, are they maintaining their oxygen? If not, how much to give? And I would give it to the simplest route first possible, which is nasal prongs. If that still doesn't work, I would go to the next step, which is give them oxygen, increase the volume via a face-nose mask. If that still doesn't work, I would want to give it to them under a little bit of pressure. That's the CPAP you mentioned. If it's still not working, I would then have to consider, should I consider giving the patient support to breathe properly? And that's the respirator that we talk about, helping them breathe whilst their lungs recover. So those would be the stages I would slowly go through, item by item, very carefully.
Dr. Barrett, the key thing here, just quickly, is that speed is really of the essence because patients can deteriorate quite quickly. So the Prime Minister is in the correct place.
He's in absolutely the correct place, and I like the way our ITU intensive care unit teams work because it's not one person. It is a team of experts, and they will be making collective decisions based on quite a lot of amassing experience. So you are in the best, safest place that you would want to be if you had this affliction with a coronavirus infection.